Well, the DA in Gauteng says it's time for the government to admit that the public sector is in crisis. It's been 28 years of South African democracy, but government is still failing to deliver on some of these democratic promises and gains. In this instance, the right for all citizens to access healthcare services when needed. The COVID-19 pandemic has also added weight to the overburdened and struggling public health sector. Let's bring in our reporter and fellow eNCA, Heidi Giokos, who's been looking at some of these challenges. Good afternoon, Heidi. Thank you very much for coming in on today, this hour. When you think of healthcare and you think of 28 years of democracy, one would have hoped that there would be a lot of progress made at different levels. The quality of the service, the accessibility of the service, the infrastructure. But we've seen this being a mission. It's a crisis that's been happening. You've been speaking to some people about this, I understand, including the Premier's office. What are you hearing?
Yes, so what's interesting here is that the Premier's office here in Gauteng, given the state of our healthcare system in this province, they don't believe that there's a crisis. They believe that progress has been made. They also believe that as much as there is pressure and as much as there is a burden on our healthcare system in this province, they are doing all they can to address the issue and the problem. However, what has been identified as a massive issue by the Premier's office is that many people move to Gauteng for job opportunities or whatever else it might be. And this is going to, of course, put pressure on services like healthcare. And this is what the province is currently dealing with. And this is how the Premier's office has explained it, to say that nurses and doctors are under immense pressure because they are trying to deal with the influx of people. So, for example, let's say in year 2020, that might be a bad year because that was COVID, but just give an example of a specific year, they had 1,000 patients, and that sometimes doubles or even triples in the next year and the following year because of the amounts of people that move into the province. However, it doesn't justify the state of our hospitals and the state that our hospitals are in, under-resourced, understaffed, and just major issues where people are even scared to go to public hospitals because they're not sure if they're going to come out alive or with another sickness that they had not gone into that hospital with. But the Premier's office says they acknowledge the challenges, they accept the challenges, and they don't feel as though healthcare is degressing in the province, but rather progressing. Let's listen in on that.
Well, we all know it's a crisis, but the department refuses to describe it as a crisis. First of all, I think you need to know the extent of the problem. We're here at Johannesburg Hospital. There's a massive parking problem just to start off with. They're short of staff and equipment. The hospital still isn't fully reopened. And at hospitals like Helen Joseph, it's just terrible. I mean, people are crammed into corridors. It takes them days before they get into a ward. Doctors and nurses are at breaking point, and yet, the powers that be won't describe it as a crisis, and there's still corruption and wastage of money, and nothing seems to come together. It's just too terrible for words.
So, Bradan, we actually just confused the two. That is indeed the DA's Jack Bloom, who is in and out of hospitals here in the province, and says that the Gauteng...
He's like the DA's shadow
NEC for health, yes.
For Gauteng, yeah,
and he says that the government here in this province must just acknowledge the fact that there is indeed a crisis. But let's maybe listen into what the Premier's office says, where they say there is no crisis and we're actually dealing with the challenges the healthcare system faces.
Level best, and I think it must be put into a context. If you look about Gauteng, it actually over a period of 5 years attracts about 1 million people, and obviously those people come in looking for medication. And if you look at people from outside the country who are coming to South Africa, 50% of them come to Gauteng, basically. So it gives you an indication of the stretch of the health system. But I can tell you that the guys at health are trying their level best. But part of the things that we have then started to make it as a strategy is to decentralize health. Give more powers to the hospitals and make sure that actually people who go to hospitals are going for referrals. Because if you do have headache, go to the clinic so that you don't basically clog up the system in the in the hospitals. But I'm saying if you put it in a whole broader context, Gauteng is the fastest growing province in terms of the population wise. So the health system is bound to to have a bit of a pressure.
Now, Heidi, before I let you go, Gauteng says it's planning to invest 3 billion rand in refurbishing hospitals.
Yes. So a statement was released earlier today, actually, Bradan, and we do understand that Gauteng is planning to invest 3 billion rand to refurbish hospitals. The statement further goes on to say how their compliance program, which has received a lot of public scrutiny following the fire at the Bank of Lisbon, is being implemented, and 15 priority hospitals across the province will be, of course, prioritised at a cost of 3 billion rand. Of course, there's many questions as to whether or not that money is going to be properly utilised, because we've seen time and time again where money is allocated and then hospitals do not have the necessary resources, are not refurbished. There are massive problems. If we just look at what was going on today at Charlotte Maxeke, where we met the DA's Jack Bloom, there's absolutely no parking. Doctors and nurses are currently parking on the side of the road. They have to get out on the busy road, and then they go back and their cars have been stolen. So someone might look at the situation and go, but how does it affect healthcare? It does, because nurses and doctors are under pressure. They come back, their cars are gone. They are working in environments where they don't have enough resources. So the problems are many, and we're just hoping that this 3 billion rand that has now been allocated is going to make some difference and is not mismanaged like we've seen previously with other money that's been allocated to the healthcare system in Gauteng.
Yeah, there was a South African doctor in one of the hospitals, and whose heart was poured out on an opinion piece. I'm trying to talk to him tomorrow. You can't save children's lives because of the state of the public healthcare sector and the lack of resources and all of that. Thank you very much, Heidi, for the update. That is Heidi Giokos there. Now,